Okay, this is Excelsior College, Nursing 105, Module 6.4, I believe. We're going to be administering a 50 milliliter bag of medication. First thing we're going to do is we're going to acknowledge the MAR. We have an order for 1 gram. And we have a bag here that has 1,000 milligrams, so that's equivalent there, of ciprofloxacin and generic name cefazolin. I'm probably not pronouncing that correctly, but it's the same medication there. And we're going to determine if Mrs. Davis has any allergies. Mrs. Davis, do you have any allergies? No, that also matches the MAR. Obviously, we're going to always check with the patient as a last resort on allergies there. So we're also going to acknowledge and identify Mrs. Davis. Can you please say your name and date of birth, ma'am? Name Ellen Davis matches her name band, also matches the MAR. Date of birth 9/19/64, again matches the MAR, matches the medical record that I have, and she's verbalized that to me also. We're going to go ahead and perform a little hand hygiene with some hand sanitizer. We do not have, this is not a sterile technique, so we don't have to worry about sterility in this, but we do need to try to maintain an aseptic technique. We're going to check our fluid bag for expiration. It says July of 2022, so that's good. Even if it didn't, we're going to pretend it's the correct expiration, but we are verifying that it is not expired. And also we have the correct concentration. We have 1,000 milligrams or 1 gram in 50 cc's or 50 milliliters of fluid there. So we have our secondary IV set there, which is what we need, just a short one there. So we're going to go ahead and open up these bags and get this going. I'm going to go ahead and leave that in the bag there while we get everything else. While I get myself in position here. Ooh, sorry. This here is to hang a bag a little lower if we need to, and we won't need to be using that, but you could use it if you just have a single pole. You hang on your regular line there, and then you hang your secondary bag down there. So, all right, just getting our line straightened out here, so we're ready. Open up our bag here. Look at this stuff. I have never opened a bag that was this tough. Come on. Riveting TV here. Okay, this is, let's try the other end. If we can do that. No. For some reason this bag was misprinted or whatever, I don't know. It's sealed, something like that. But I am going to take a official liberty here and use a pair of scissors to open this bag. Okay, we have the bag open. Our bag inside is still intact, not compromised by me using scissors to open it. Okay, 2 different ports. Very unlikely because this is a medication and this would be labeled properly inside of the package, of course. Sometimes it's a bag the pharmacy makes up, so might not have it there. There should be a secondary label that you need to put on here for medications. But we have our drip chamber here, so we're going to go ahead and lock this off so we don't lose any medication down the line here. And we're going to go ahead and spike this little bag. Pull the cap off there, this cap off. This is sterile. Inside of this port is sterile. Go ahead and spike it. We're not going to open the drip chamber yet because we're going to use the primary line in order to infuse this chamber and prime it. So we're going to go ahead and put our primary line higher. Going to hang this one lower. And now we're going to go ahead and sanitize our hands one more time. Make sure our hands are dry. And make sure our IV site is good. We don't have any redness, we don't have any infiltration, no phlebitis. Put our gloves on. Again, aseptic technique, not sterile technique. And we are going to select the site that is closest to the drip chamber for the IV. So we're actually going to put this one up a little bit higher there. So we're not going down, we're not so far below it there. But that is closest to the drip chamber of the primary line. We're going to clean that with an alcohol pad vigorously. Make sure we're clean. And I'm going to put our secondary line into that one. This tip inside here in this lower lock is clean, so make sure that stays clean. All right, and we're going to go ahead and open this chamber on our primary line and open our secondary line chamber, and the line is backing up with fluid filling the secondary drip chamber. And wait till we get about halfway. I'm going to stop both of them for a second. Then we're going to switch places. And now we have our medication in our secondary chamber there. Probably kind of hard to see with my video here. Medication in our secondary line, which is higher than our primary line. We're going to use our primary line to set the drip rate, and we've determined our drip rate. I should have said that initially, I'm sorry. We need to infuse the 1 gram of Keflex or ciprofloxacin, sorry. We need to infuse that over 30 minutes. The doctor wants it infused over 30 minutes. That's a standard for that medication anyway. But 1 gram over 30 minutes. And that rate on this chamber off of this line is going to be 17 drops a minute, which if you're working it out math-wise is going to be at 1 every 4 seconds. So we're going to go ahead and set that. Our line is already set up from the previous video, so go ahead and make sure that's dripping. Make sure this one is open. Actually, this one's all the way open. We're going to set a drip rate on this one. Sorry, I got that backwards. Set a drip rate on that one. One every 4 seconds. So this one should be at 125 an hour, about 1 every 3 seconds. And we are going to go ahead and make sure that's flowing properly. We're going to go ahead and make sure that we have our there's no reaction to the medication. We're going to make sure we document it in the MAR properly. I'm going to go ahead and shut these down so I don't get too much fluid falling out there. And that's it. Oh, I'm going to remove my gloves, perform hand hygiene, before we document it in the NUR. Just a quick addendum to that video, continuation of that. The drip rate is set with the lowest clamp, which is on our primary tubing. So that's where we would set our drip rate, and I already said that would be 17 drops a minute. So just a quick clarification on that. I just got a little stage fright there for a second and said it wrong.